So welcome everybody on our fourth annual patient and parent long QT seminar. We are happy that we could continue this endeavor, and we have today distinguished guests, Dr. Sam Sears, whom we see right now on the screen, who is professor at East Carolina University in Greenville, North Carolina, and who is famous psychologist focused on aspects of how to deal with risk of sudden death and having ICDs, wearing defibrillator, and several other topics. And we have also pleasure to have our former PhD student, Meng Wang. Thank you, Meng, for joining too, who will be quoted a couple of times by me today during the scientific part of the presentation. And let me welcome everybody in the room here. We have Ilan Goldenberg, who many of you know, who is director of CCRC and long-term researcher in long QT syndrome. Next to Ilan, we have David Wang, who is director of EP services here, and across we have Mehmet Aktas, who sees also a lot of inherited arrhythmia patients and par excellence electrophysiologist. Here next to me, we have pleasure to have Chris Cutter, who, as you know, is manager of the long QT syndrome registry, which is in operation for 40 years. She wasn't born yet at that time. Next to me is Bonnie, who also is so young, and she is very devoted, as you know, many families know them well, as well as Becky Horn, who is in contact with so many families of long QT patients. Let me also stress that we have pleasure to have Spencer Rosero, with whom many of our long QT patients had chance to interact during our studies, and he's currently chief of cardiology at University of Rochester. And last but not least, we have Perry Nemeczek, who is nurse practitioner seeing patients with long QT and similar arrhythmias, who will also share her thoughts on the topic. And did I miss anybody? I think we are happy to have you all here, and without further ado, I will ask Ilan to say a few words about CCRC.